everyone, my name is Alexis McWhorter, and I am currently an MSN student at Eastern Kentucky University pursuing the Family Nurse Practitioner track. This presentation will discuss the importance of ensuring patients diagnosed with heart failure are compliant with medication regimens. The purpose of this review is to explore, in adult heart failure patients, how does medication compliance, compared to those who are not compliant with medications, affect risk of readmission and death within 60 days of hospital discharge. Literature reviewed proves several interventions have been explored, and this topic has been researched as a prevalent issue. As displayed by the Office for Disease Prevention and Healthy Promotion in Healthy People 2020, heart disease is the #1 cause of mortality in the United States. 1 out of every 3 Americans are living with some form of heart disease. A large portion of these patients can be managed with lifestyle modification and medication regimen, but in order to decrease the risk of further hospitalization and morbidity, the patient must be compliant with the treatment plan. This also makes it important that the nurse practitioner consider the patient's preferences when we develop the treatment plan. Aside from the burden that is placed on patients who are trying to manage their own care appropriately and independently, it is important to note that admissions and readmissions of patients with heart failure exacerbation places an enormous strain, financially as well as resources, on our healthcare systems. According to Healthy People 2020, it is approximated that heart disease patients account for about $320 billion of healthcare expense annually, not to mention it is as well the leading cause of death in our country. Research has explored that the promotion of patients to manage their own care and become independent in doing so can improve their outcomes. Pinder's health promotion theory explores factors on why patients may feel a certain way about their diagnosis, treatment, or plan of care, and the factors that can be changed to improve behavioral outcomes. Pinder's theory addresses questions such as why is the patient's behavior this way, and how can advanced practice nurses implement interventions to be able to produce a more favorable patient outcome. Literature review is important to determining answers on how medication compliance can improve patient outcomes. A search was conducted for systematic review and meta-analyses, and one in particular fit criteria for this topic. The study, titled Medication Adherence Interventions Improve Heart Failure, Mortality, and Readmission Rates, Systematic Review and Meta-Analysis of Controlled Trials, explored different interventions from 57 studies used to increase medication compliance. A few of these consisted of medication education, disease process education, healthcare provider education, and self-management. Level 2 research was also explored and analyzed a randomized controlled trial of patients at the inpatient level of diagnosis who were being managed for heart failure exacerbation. This study consisted of 96 participants who were randomized into control and intervention groups using a computer system. The intervention group of these participants were imposed into a strict nurse-led education program as well as a strict follow-up regimen. Intervention group participants received 2 hours of inpatient education from a nationally accredited heart failure nurse, as well as telephone or telehealth follow-ups every 8 weeks and a face-to-face follow-up every 4 weeks. The control group received usual care, education given to those patients that are discharged after a heart failure exacerbation, and a 2-month follow-up. Results displayed that the use of these programs can encourage the patient to be more compliant, more independent as far as self-management goes with their care, and decrease the risk of rehospitalization. Level 4 research, or qualitative research, was also explored. This research showed the views and experiences of healthcare providers that they had had in the past with patients diagnosed with heart failure, and also the issues between multidisciplinary teams when we're caring for heart failure patients. It was determined that there was a gap in communication between both physicians and patients, as well as between physician to physician as far as cardiologist and general practitioner went. The proposed intervention to this was a specialist nurse, heart failure nurse, who was a coordinator of care and a patient liaison for communication. This improved patient outcomes. Using research, the advanced practice nurse can gain knowledge on not only heart failure patients' behaviors, but interventions that we can implement to improve compliance and therefore decrease the risk for sequelae following a heart failure diagnosis. Being able to understand the why behind patients are not adhering to their treatment plan is the beginning step on creating their personalized plan of care. A proposed option for the intervention would be collaboration or implementation of a heart failure specialty nurse. This nurse could provide communications for patients as well as specialized education on heart failure, how to monitor for signs and symptoms of fluid overload, and why it's important that we adhere to the medication regimen. They could also follow the patient as a kind of care navigator within a primary care practice to decrease the risk of hospital or rehospitalization and decrease the risk for mortality. It is important to note, however, barriers may pose an issue when we are trying to implement the use of a heart failure specialty nurse, both financially as well as the availability of a specialty nurse with this type of accreditation or education to provide education to patients. While it is important to maintain a positive outlook for our patients, it is also crucial to provide real, meaningful information, even if that information is hard for the patient to digest. Whether done by the advanced practice nurse or in collaboration with the registered nurse who is a specialty nurse, it is important the patient is educated on what the risks are for not adhering to their treatment plan, for not adhering to their medication regimen, as well as what this diagnosis constitutes for their daily lifestyle changes. Thank you.